So at issue for Democrats in Washington with the government shutdown was a tax subsidy, an enhanced Affordable Care Act subsidy to help people pay for their health care. We're getting ready for the news here at 4 o'clock on 11 Alive. I asked one Georgia Democrat, Congresswoman Nikema Williams, why not come after the healthcare companies and the insurance companies for the high cost so that the subsidies aren't needed? This was her answer. According to the Joint Committee on Taxation and Congressional Budget Office, a permanent extension of these subsidies will cost nearly $350 billion over the next 10 years. Republicans say it's too costly. Congresswoman, why not go after the health care companies and the insurance companies so that the subsidies are not needed?
So let's be clear, Faith, that this healthcare crisis was caused by my Republican colleagues. In Georgia, as you know, we still have not expanded Medicaid. So there are people literally too poor to even afford health insurance because this system works when we all have coverage and you don't have like a have and have not system. So for one, I think that we should have some form of universal health care so that everybody is covered. I have been a proud co-sponsor of Medicare for All because I feel like healthcare is a basic human right. So I can get into the semantics with my Republican colleagues over if they want to fund ACA subsidies. But at the end of the day, what I want is for people to get coverage because there is a Republican healthcare crisis in this country. And if they want to come to the table and bring about a different proposal that makes sure that everyone gets coverage, then I am ready to have that conversation. But as of today, as I stand here ready to go on the floor and vote no on this bill, we still have not seen a proposal from my colleagues. They are willing to go home on the Thanksgiving week and say, oh, we reopen your government, but guess what? You're now not going to have health insurance.
Congresswoman, I hear you. I just want to press a little bit. Has there been any effort at all to try and decrease the cost of health care in general? Not extra coverage from the government because the prices are high, but nipping the bud as to why the prices are high. Yes, ma'am.
That's how you reduce the cost. That's by making sure that you don't have sick people who can't afford health insurance because they're too poor going to the ER, raising costs. You have to have a system where wealthy people and sick people are in one pool. That was something that my Republican colleagues pushed back against, having everyone insured when we were negotiating the Affordable Care Act. And so this is a system that they created, but now they're against it. They've always been against the Affordable Care Act, but I am waiting on their plan. I support, again, Medicare for All so that you don't have a system of where only the people that can afford it or only sick people are left out, and that raises costs for everyone. So what we need to do is come to the table and negotiate something that gets all Americans the care that they need. I'm ready and willing to do that. I have not heard that plan from my Republican colleagues or been a part of any conversations, nor have my leaders here in the Democratic caucus had those conversations either.